It don't give you 26. It only give you 25, 30 by fives. Okay. All right. Hello. This is CORTEZ, and we're doing the IS spirometry walkthrough. Okay. So today we're going to be, like I said, doing an IS video. So just before we start, reasons why we would do this IS video was say for do incentive spirometry therapy is for patients that have atelectasis or predisposing factors to atelectasis, such as upper and lower abdominal surgeries, neuromuscular disorders, surgery in COPD patients. What did I say? Upper or lower abdominal surgery. Patients that's on prolonged bed rest. Contraindications would be patients that's heavily sedated or comatose, patients that are like young kids who are unable to perform it, patients that have some mentally altered statuses. Those type of people won't be able to perform this because this is completely patient dependent, this surgery. Okay, I'm saying this, not surgery, this therapy. Hazards of this would be hypoxemia for the interruption in O2. Other hazards would be hyperventilation, oh, fatigue, bronchospasms. Okay. And also this would be ineffective. It would be ineffective technique without the patients doing the right thing. So, So, first I'm going to start off by verifying my orders. So I'm going to look at the chart. Okay, we're IS spirometry today. After I look at the chart, I would assemble my equipment, which is the spirometer here. And we got the tube here for the mouthpiece. And we have the paper here that you will use that came with this device, and is based off the patient's age and the patient's height. That's what we will put the volume for. So for a person that's 25 and 6 feet, we will put this here at 2150, which is approximately right there. Okay. So we have our equipment. I'm going to, I got my equipment here. So I'm going to verify my patient. Could you tell me your last name and your date of birth, please?
My name is Alexander Cortez. My date of birth is 03/04/1999.
Okay, thank you. And we verified our patients. Now I'm going to wash my hands and don my PPE. I'm going to wash for 20 seconds, rinse for 10, okay? And then I'm going to go get my gloves. Okay. My PPE. So now I'm going to verify that this patient is able to perform these procedures. Make sure that he has that he's able and have a non-altered mental status. Okay. So my patient, I confirmed that he's good to go. So now I'm going to instruct him on how to use this device. So first, just a heads up. Now, after I teach you how to use this spirometer, okay, it's important that you perform this every 6 to 10 breaths an hour, okay? So that means whenever you take a break or you watching TV or something, commercial comes on, take the time out, perform this maneuver, okay? All right, so here we have the volume, which is set to. You have your mouthpiece, and you have this little green little piston. So that green little piston is gonna go up here to the smiley face. You want to keep it in this, try to manage it here between the two arrows in that smiley face, okay? That's how you know you're inhaling properly at a good flow, okay? Because it's going to be slow breaths, okay? Slow, deep inhalations, okay? Once you get up here to this green, you're going to hold it, okay? But you don't do this until after you take a normal breath. So you'll take a normal breath first, then you'll put your mouth around, you'll take a normal breath first, put your mouth, after you've exhaled, you will securely put your mouth around this tube, okay? Please don't block it with your tongue, okay? Because then you'll make yourself pass out. You won't get anything done, okay? Once you do that, going to okay. So we're gonna begin after deep breath. Okay, and so before we begin, we're going to do the vitals. Okay, going to assess your patient's heart rate, respiratory rate, SpO2, blood pressure, temperature, and most importantly, breath sounds. Okay. So, all right, great. We assessed the patient's breath sounds. Now we can begin, okay? So, now, exhale normally. Okay, when you are inhaling this, slow, deep breaths, okay? Don't try to go too fast, too slow. Just nice, slow, deep breaths, okay? Put your mouth around the seal. And also important that this patient has to be sitting up when performing IS or in a semi-fowler's position, okay? So you must be sitting up all the time. You can either sit this on the table or you could hold it upright in your hand, okay? So, seems like you've done this before. Okay, make it tight seal. Don't occlude, inhale, doing great. You're doing great. Now you're there, hold it for 1, 2, 3, 4, 5, 6. Good job. Great effort. Now the patient is going to take several normal breaths. So after this, he's going to breathe normally for several times, okay? Good job. Good job. So after the patient has performed a maneuver, going to assess the vitals again, okay? So we're opening up those lungs. We're opening them up. Okay? Heart rate, SpO2, respiratory rate, temp, blood pressure, and breath sounds, okay? All right, magnificent. We're gonna perform this again one more time. Okay, so as I instructed you before, go ahead and after a normal breath, after a normal exhalation, that's when you put your lip around the piston, around the mouthpiece. Don't block. And got a headache? Hold it upright. Patient will hold this upright, okay? Patient sitting up. Okay, so the green piston is going to go to the smiley face. Hold it in between the two arrows till you get to 2150, which is his value. Hold it for 5 to 10 seconds. 1, 2, 3, 4, 5, 6. Good job. Good job. Patient's gonna breathe normally. Reassess. Heart rate, respirations, SpO2, blood pressure, temp, breath sounds. Okay? We're opening up those lungs. Opening up the alveoli. We're recruiting those alveoli. Okay. And we're going to do it one more time. Hold up. Okay. Patient having a time. This is how you know it's working. Is open up those lungs. So now we performed this on the patient. Now, if you want to challenge the patient, you could move this up a little bit. Okay. You can add more volume to it to give the patient a little challenge. Okay. All right. So now that great therapist helping them out. So now that we're going to boost it up to about 25 to see if he can handle this. Just to challenge them, we want we want that lung to expand, okay? If you can, okay? Yeah. Hold it up right. Make a tight seal. Yes, good job. After a normal exhalation, not crazy exhalation, okay? Happy face in the mid. That's right, green piston on the happy face. You at the 25, hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9. Patient has done a great effort. Did a great effort, performed very well. So as I was saying earlier to the patient, patient Cortez, you're gonna perform this 6 to 10 times every hour. I know it might be a little tough, but it's necessary, okay? Absolutely necessary, okay? When we get to a commercial, that's when you can do it, okay? So we're going to, after this last one, we're going to assess again because it's important to always assess afterwards, okay? After you perform the IS, okay? Heart rate, respirations, SpO2, temp, blood pressure, breath sounds, okay? Right, magnificent. Patient's definitely improving. Okay, so now that we've done that, I've informed the patient how to use this, when to use this, and the importance of using it. Okay, now I'm going to ensure that my patient is comfortable. Got, give him his car remote, make sure his bed rails up for safety. Okay, then afterwards, gonna take off PPE, decontaminate my hands, wash them, or put sanitizer on them for 15 seconds. Then I'm going to chart and relay the information to my health team. Okay, thank you so much.